Moving on to interventions. So first thing first is the pain management because the pain level is still high at this moment. It's
Yeah.
only how long was the operation was done? For
Fourth
On her
post
fourth day.
yes, fourth
Post-op.
day, so it's still
Fresh.
painful,
Yeah.
still fresh. So, in under the pain management, the patient is given analgesics. Yes, namely ibuprofen 400 milligrams and paracetamol 1 gram. Well, that's a very good combination. I experienced that before. Paracetamol was not enough even though it's 1 gram, so it's a very good combination together with ibuprofen because there is still swelling. And the second one is other non-pharmacological methods such as ice packs and positioning and relaxation techniques as well. Even deep breathing, it can also helpful to the patient. And then and the next one is infection prevention. So under that, we can educate the patient and the caregivers or the family on proper wound care because there will be no longer nurse with the patient at home, so only family members. So it should be proper, like it should be clean wound dressing.
Yeah, I think
Yeah.
it's also important that the patient and family members have the knowledge on how to do the wound care, right?
Exactly, yes. Because they are not doing that in daily basis only yeah, so they really have to do it properly. And also they have to monitoring the surgical site for sign of infection because sometimes the dressing is dry. It's because the pus will be on the later stage of infection, so they have also to check the wound itself. It's really dry and not swelling and not red, so there's no sign of infection. That's a good thing to do. Prevention is better than cure. And the next one under infection prevention is encourage good hand hygiene practices. So hand washing, universal.
Yeah, before and after.
Yeah,
right?
before and after. So, and then another intervention is for mobility and safety. And under that, we can assessment to the patient with ambulation and transfer as needed because moving is important, so the circulation will be continuously, so the wound healing will be fast.
Yeah, and the embolism can be prevented.
Embolism, yes. So move.
Yeah.
And the next one is teach the patient how to use assistive device correctly. You were mentioning this rolatory and
Walking cane.
Yes. I don't know how to use that, so patients should know how to use that, and so that the education takes in place. They should be instructed properly.
Especially when she had the hip surgery.
Exactly.
They need to have the rolatory in all
Prevent fall.
yeah, to prevent fall.
Yes. Yeah, and in addition to that, also implement fall prevention strategies such as removing hazard and ensuring adequate lighting at home. So, bright, yes,
Yeah.
bright
And free of-
lights.
Free of space, so she is
Yes.
able to move.
So remove
Easily.
the small things that can
Or
so
mat.
more spacious
Yeah.
is better. It's more better if spacious, right?
Yeah.
So he can move
Easy
freely.
access.
Yes. Yeah, and then under intervention we can also, skincare also under intervention, we should reposition the patient regularly to prevent pressure ulcers. So because it's still painful for the patient to move by himself, so
Yeah.
support should be.
Maybe she will have like a limited movement at that
Yes,
time.
because of pain.
Yeah.
Even though the patient receiving pain reliever, it's still
Still
painful when
there.
it's
Yeah.
moved. I had that experience before, so help from family members is important.
Or we could have this chart that we would give to the patient. So every Monday, this position would be her night position.
yes.
Wednesday, and this.
Yeah,
and
we can
those
give
kind
her
of.
instructions like that. Yeah,
Mhm.
that's true. That's a good idea.
Yes, yeah. So they can keep in track of
Mhm.
the movement. And also, in addition to the skincare, we use pressure relieving devices such as cushions or mattresses. Yes, the
Something
soft,
soft.
The lima.
Yes.
ma-
the softer one. So
To
yeah,
avoid pressures with
Yeah.
the operated
The
side.
surgical side.
Yeah, the surgical side.
yes, exactly.
And also nutrition and hydration is important. We should encourage the patient, especially she's 79-year-old female. It's good that her diet would include like rich in proteins.
Mhm.
Like so for the nutrition and hydration, of course she's post-operated. It's better if we could like encourage her to eat foods rich in proteins, vitamins and minerals to promote healing. Like what's good protein? Like meats and then eggs and what else? Vitamin rich foods, fruits and then vegetables.
Vegetables.
Yeah.
That is true.
Promote healing.
Yeah, sometimes they could also buy from apteke the Nutri-Drink to have that, or Cubitan,
Yeah.
so that it would have a faster healing on the
Yeah.
wound.
Yeah, that's true because maybe she's post-op, she doesn't feel like, especially
Eating.
Yes.
yeah,
She doesn't have the
the
Appetite yet.
appetite to eat. And then of course the adequate fluid intake. Yeah, the one you mentioned, Nutri-Drink, it's good because as we all know, old people, especially senior ones, they don't like,
To
they
eat.
have poor nutrition usually. Yeah, they easily get weight loss fast.
Yes.
Yeah. And then, of course, education and support. We should provide education on medication management, the wound care, and the signs of complications for the wound. For example, if it's still swelling, even though it's been many days, and then there's redness, and it feels sore, what do you call that? What else are the signs of
Signs of
infection?
it's like hot, like
Yes,
Hot,
hot,
yeah.
yes.
We should encourage her to report back to us.
Yes.
or
That's
call the
right.
nurse,
Call the
right?
nurse, yeah.
Mhm.
And then, not also on the patient, we should also inform the relatives who takes care
yeah.
of her. And then, how to properly cover the wound. When she's at home, should always encourage the hand hygiene.
Hand
Yeah.
hygiene, back to the hand
The April
hygiene,
mentioned a
yes.
while ago. And then, we should also offer emotional support and address any concerns or fear, especially she's post-operated. Normally, old people are prone to loneliness, more
And
lonely,
fearful.
and fear. And then since she had surgery, there could be like a feeling of disturbed body image.
Yes.
Yes.
Should tell her that it's
Yeah.
normal and it will heal soon if she follows the proper instruction.
In addition, in addition to that, because everyone knows that when you're a person getting older, it's also slower the healing is.
Yeah.
So that's also contribute that the patient might feel lonely and anxiety. So yeah, emotional support is important to the part. Yes.
Yeah. And then connect the patient and family with community resources or support groups if needed. Maybe you could assess if maybe she has like a religion she follows or like a group. It's also important for socialization and so that she feels that she's not
Not alone.
Yeah.
That's true.
And then for the medication management, since she already had medications, she has this ibuprofen 400 milligrams, and then bisoprolol 5 milligrams, and then paracetamol. These are all for pain. Simvastatin. This is like for to prevent
Cholesterol.
cholesterol, and then the coagulation along with the aspirin and the
Yes.
enoxaparin sodium. And then pantoprazole, this is like a stomach medication to prevent maybe regurgite reflux. Because
Too
since
much for treatment of acid.
yeah, for the acid treatment. And then we should encourage the follow-up care if definitely there will be like a scheduled appointment for
Mhm.
her to come back.
Yes.
We
Yes.
should encourage her to really go back because
You should come back.
yeah, because there are times where patients after discharge they don't come back anymore.
Mm.
I think it has to do with the instruction the nurses give. We should give importance on why she should come back so that we could check how is the wound healing. Does it need more care for, or what agent needs to be, what procedure needs to be done, or for example, if the surgical site has been healing well, or we have to do something about it because it got infected. So a follow-up is important,
Mm.
and then arrange for home health visits to monitor progress and of course to provide ongoing care.
Yes.
Yeah, definitely that's it. Do you have any other
No
additional?
information, not as of the moment. But
Yeah,
Yeah, it was clear
Mhm.
and yes, and organized.
as long as we emphasize on like giving her the instruction and the importance of
Mhm.
why she needs to do this and that.
Mhm.
I think that's also for the relative to encourage to be participative with
Yes.
the treatment,
So
the
we have
management.
Yes, that's right. So we have already tackled the assessment, the planning, and of course the
intervention.
interventions. Yes, so we can prevent the complications to happen so the patient will be healed.
Yeah. I think that's it.
Yeah.
Okay, thank you so much.
Thank you so much.